Hey everyone, thanks so much for joining me on another episode of the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the CEO of House RX. Ogi, how are you today?
Good, Jared. How are you?
I'm excited to have you on. Let's dive right into it. We usually keep these short and sweet. Tell the audience a little about your background.
So, um, let's see. I've been doing startups my entire career, for better and worse. I think it started with the dot-com era. That was my first startup back in 2000. Right out of college, I was an engineer. My very first job, my very first corporate America experience was like a dot-com startup that ended up eventually failing. But I never looked back. It was startups from there on in for 20 years. And I've seen the different eras. I've seen that era, like the crazy 99, 2000, the 2008 crash, and then like the more recent bubble that seems to be have gone bursted a little bit this in the last 12 months. So I've seen the ups and downs. This is probably my third time that I've seen the up and down. But it was a thing to do when I was graduating from college as a computer science major. It was sort of, a lot of people were going to like Microsoft and Oracle, but I sort of was one of the sort of the cadre that went to the startup because it was a very new thing back then. And I fell in love with the chaos of it and the potential of it all, sort of the upside, downside. Is I'm not a very risk averse person. So that was always a very appealing to me. But yeah, I mean, I've spent the whole gamut from engineer. I was coded for the first three startups. So in my 20s, I went through a bunch of different startups. One was e-commerce was the first one, fintech another one. One was actually in the oil field industry. All as an engineer, sort of. I was just hardcore coding Java and C++, Python back then. Then you know actually, I would characterize my 20s as like wandering around these startups, kind of as a software engineer mercenary, like completely different industries, completely different sort of problems, all fascinating in their own right, but really just like as a senior, sought out engineer that would go out and make, you can make sort of a lot of money and equity. But I was never, it never really fully clicked for me. What ended up happening sort of towards my late 20s is my good friend from college, who was like 1 year ahead of me, also computer science, called me and said, "Hey, we want to go. We're trying to do something about climate change, um, and and we have this idea about energy efficiency in homes and so forth. And come join us." There were about two or three people at a time, and I did, and that was sort of a formative experience for me. It was the first startup I joined where it really had like a double bottom line. It wasn't just another way to make a business or a profitable business. It just felt like it felt different, where we were not only trying to make a profitable business, but trying to make a difference and recruit candidates, talk about what we're trying to do in climate change and CO2 emission reduction and so forth. And that company ended up that company went from concept to going public on the New York Stock Exchange. And I spent 7 years of my life. I started as a director, ended up being the SVP of product management, and it was sort of very formative for me. But that experience for me just changed everything, because once you experience that one, not only the sort of success, for we got lucky in many ways, but kind of seeing the startups go from concept all the way through all the different stages of fundings and the ups and downs, all the way to the going public process, but also the experience of working for a double bottom line company, as we called it. Maybe never want to sort of do anything different. So I think from then on, every company that I've been involved with, including House RX, had to have as a necessity this sort of integral sort of other mission, which I think it used to be more novel than it is today. A lot of companies now have a mission and sort of think that is important, but it's didn't always used to be the case, right? It was sort of like we were somewhat weird back then. So the company after that was, I met this guy Nat Turner, who at the time was a CEO, founder of this small company called Flatiron Health. Somebody connected us because I had just gone public, and they were just starting to scale out and get some traction. And I think a mutual friend connected us and said, "Hey, maybe Ogi can help you sort of with that next phase, because we had just scaled the company." Long story short, when I heard about what they were doing, trying to help cancer patients, it was just sort of immediate. I'm going to go help Nat the best that I can, because it seems like one of those things you just don't regret doing. Right. So what you learn is like when you have this double bottom line mission oriented companies, like you just can't, like, even if it fails for whatever reason, it's hard to look back and say I've wasted 3 or 5 or 7 years of my life. Like I try to do something and it was worthwhile. It was worthwhile to try to make a difference. And even if you helped 5 patients, that seems worthwhile. And so that one also worked out. I mean, Flatiron had like this like really fantastic exit with Roche and so forth. And after that, I wanted to just keep doing it. And in this case, because that was my first actually one in healthcare, um, I just thought, wow, there's so much more to do here. Like, I've been jumping around industries before that, but once I sort of with the flying experience, I was like, there's definitely more to do here. And so I was looking for the next thing to do. And after quite a considerable time off, kind of really considering many different things and ideas and so forth, I landed on the specialty, the the wondrous land of specialty pharmacy and the crazy stuff that's happening there. And it was just like we'll talk about it in a minute, but it was just eye opening how big of a problem it is and how many patients and impacts. And so we started House RX to try to make a difference in the specialty pharmacy world. It's definitely an area that needs an improvement.
And talk us through. I usually tell people you kind of already gave us the why, right? But I usually say, and I took this from Simon Sinek. This is not my own thinking, right? Why, how, what? You already gave us the why. You wanted to start it. Talk us how how you operate today, and I guess the if you had to describe it to
Well,
yeah.
let me give you, yeah, totally. Yeah, let me give you a little bit more about the why. I sort of spoke out at a high level in terms of it's an area that needs improvement, but just more specifically, one of the things that I learned as I became aware of this space in my research is, um, there's sort of two things to know about the specialty pharmacy. Most, I don't know, perhaps your audience and most people I talk to, I find that most people don't even know what specialty pharmacy means. Um, and that there is a difference between specialty pharmacy and regular pharmacy, but what it means is, so the pharmacy industry is really split into two buckets. One is like the CVSs and the Rite Aids, Walgreens, all the stuff that you see there everywhere, massive industry in its own right. But all of that together, all of those CVS, Rite Aids, and Walgreens and Costco's, etc., together is just called the regular retail pharmacy, and that actually turns out to be a smaller market. All of that together, believe it or not, I found this insight mind-boggling. A smaller market than the specialty pharmacy. It's about a $200 billion market. There's a $250 billion market and growing faster. It's called the specialty pharmacy market. And that market, 88% of that market is controlled by 4 companies. Um, and those companies also are the insurance companies, which is crazy. And there's almost no competition. It's very just sort of shadowy behind the scenes. Most people don't even know it exists. But it's not this. It sounds like a very niche idea, and it is in many respects. But it's also this massive, massive market that operates behind the scenes. And one of one of its attributes is that these 4 companies essentially are almost operate as cartels, which is they have this they have these sort of carved out like territories, and nobody else can really enter because they also bought the insurance companies that are necessary to pay for the medications. And a very important consequence, and this is what got me to really start House RX, is when you start looking at that and you start going down the rabbit hole and understanding the impact on the patient. So you can ask, okay, so what's the problem? So what if 4 companies control, this world? Google controls search at the moment, at least. Is there really a problem? And there is a problem in the specialty pharmacy sense, in that this patient experience is absolutely atrocious. And the reason is the companies that don't there's no competition, there's no patient choice, so they don't compete for the patients. So they don't really invest in making the patient experience very well, and so very good. And so what the observation was this, which is those patients who need medication the most. Basically, if you're being prescribed a specialty medication, it means like you're probably battling a serious disease. Those patients who are battling the most serious diseases have the hardest time getting access and they're hands-on for a variety of reasons to their medications. And then if you read the patient stories, when you read families of cancer patients and other diseases who are struggling to get their medication and sometimes life-saving medications on time, it's just heartbreaking and incredibly frustrating and also incredibly motivating for an entrepreneur to try to do something about it. So that's the real why, is we're trying to help those patients who need these life-saving medications to get access to them faster, quicker, easier, cheaper. And it's a very complicated problem. Um, and so so that's the why. The what is, so the obvious solution would be, the knee-jerk solution is to sort of, oh well, let's start a specialty pharmacy and see if we can do a little bit better. There was It's not, and a lot other people have tried this solution, and it turns out that because of monopolistic behavior between the PBMs and so forth, that we don't may not have time to get into all of the nuances. It's very difficult to succeed as a business, as a specialty pharmacy, and it's very difficult to actually have impact at scale. It probably take a decade to have any sort of market traction. So instead, we landed on a somewhat novel strategy to try to make a difference in this market, which is to create a platform that manifests hundreds of mini specialty pharmacies by enabling clinics, specialty clinics, to actually become mini specialty pharmacies themselves and kind of leveraging the infrastructure that already exists all across the country. Uh, and there are a lot of benefits to this approach, but that is our vision, is to take this market, which is a $250 billion and growing something like 10% year over year, that is dominated by four companies, and have it be disaggregated into hundreds of mini companies, and we believe that will lead to a much better patient experience.
So let's talk a little bit about the patient experience you just mentioned, right? So how are patients failed by the current system?
So I'll give you an example. So it's maybe most helpful to talk through that through a quick example. So you go to a doctor, you have rheumatoid arthritis, they prescribe you Humira, which is for the last 15 years been the most successful, sort of biggest blockbuster drug in pharma. Very, very commonly used for a lot of different indications. Um, what you'll find out quickly is you'll walk out that clinic with that script, and it's basically good luck getting it. What you'll find out if you haven't been prescribed a specialty medication before is you'll perhaps naively try to go to CVS, and will quickly learn that CVS doesn't carry it because it costs like $8,000 a month, by the way, and you keep using it for years. And then you're like, okay, well, where do I get it? And they tell you, well, call your insurance company. And then you call your insurance company, they put you on hold, and then they say, yeah, there's only one place to get it. It's from our pharmacy department. Let us transfer you. And then they transfer you to the pharmacy department. And then you realize it's the pharmacy department that's within the insurance company. And they put you through the whole rigmarole and try to set up an account over the phone. And they'll say, well, we're going to have to ship it to you from somewhere in the middle of America, from a warehouse. But before we do that, we're going to need prior authorization. And so we need more information from your doctor. So then you go back and be like, okay, well, call your clinic back and say, hey, they're asking for this extra information. They're asking for my labs and blah, blah, a bunch of different things. And then you're calling the clinic. Say, can you fax it? Usually fax it to them. And then they say, okay, got it. We'll do that for you. Next thing you know, it's 3 weeks later. You call the insurance company back, and this is true. Like, you can actually Google it this morning, and you will just find stories like this. It's just absurd. That's still happening. You call the insurance company back, and they again transfer you over to this department, and they're like, hey, did you get the fax? The nurse at my clinic told me that you sent it to you, but like, no, we haven't received it. And then you're sitting there like, what is going on? My doctor just told me I'm very sick. I need this medication. Like, what else do I need to do? And that's even before we get into like the financial issues. And let's say you get through all this, and they say, well, you owe to $1,500 for your copay because this is a specialty, and they're like, well, I don't have it. And then a huge percentage of the patients at that point just gives up. It's already been like 2 weeks. It's been horrible. Like, I don't have $1,500. I'm not going to do this. And then they just like don't follow up, and nobody follows up with them because the doctor that prescribed the prescription to begin with doesn't even know that this is happening. All they did was they wrote the script and be like, here's what you should take. I'm going to go see the other patient. That's my job as the physician. It's your job now as a patient to figure out how to get your hands on this thing. And then these patients just get lost in the middle, which is a completely stark opposite. Then you get prescribed an antibiotic. You just walk into CVS, you pay $10 copay. They have it right there on hand, easy peasy. Like there's no big problem to solve there. But the moment you step into the specialty world, it's a nightmare. And the irony is, these people are the one. Like, this is not like like a small infection that you need like a 3 course days antibiotic. This is like a lifelong disease in many cases that you need to really seriously take and manage actively without delay. And so the whole system, I mean, most people don't realize this because actually the specialty pharmacy only impacts less than 5% of us. And so for the 95% of the population, they have no idea that this is a problem. So it's just a complete failure of the system. And then to make it worse, these insurance-owned specialty pharmacies, departments essentially, they don't have any financial incentive really to make this customer service experience any better for a bunch of different reasons. One, because they're the payer also. So like, why would I try to hurry and get cost my insurance company more money by getting more patients, more access quickly? There's sort of the more cynical view, but there's also like the way they get, by investing more in customer service doesn't get them more patients, because their patients don't have a choice. The way they get more patients is by having their insurance arm be more successful in employer-facing RFPs. If they're sitting there in their management meeting saying, we want 1 million more lives to cover this year, well, the only way it's not by investing in customer service, it's by winning more employer-facing business. So what do? They hire more salespeople and hire more people who are writing proposals to employers, and not by investing $50 million in a more beautiful and seamless customer service. That doesn't do anything. Even if they did that, it wouldn't change the number of patients they're covering. So the whole system is like it's very easy to see why this is a problem. They're not incentivized to do anything about it, and so we think this needs to change. And this whole system just needs to be like disentangled from itself, and just have this the tried and true bring about this tried and true notion, a very American notion, I would say, as an immigrant, I would say a very American notion, which is competition and an open access and free market will actually solve this if it's allowed to run. And one of the key requirements here is to let patients have a choice of a specialty pharmacy and let those specialty pharmacies compete for their business, which is something that's not happening today.
What are you excited in terms of? What are you excited about in terms of what's next for House RX?
Um, well, we're this is sort of so our business model is to help clinics do this, and we didn't know at the beginning, somewhat of a weird idea, for lack of a better term, sort of to try to attack this market in this way. And what we're finding is that the reception from the clinics and the doctors that we talk to has been so overwhelmingly positive, and we've been selling and getting traction and adding clinics to our network so much faster than even like the rosiest Series C deck that we put together for our investors, which we had it up to the right curve of sales with like rose colored glasses, and we've like exceeded those decks significantly in real life. So I'm just excited. It seems like over the next year or two, we're really going to get to scale. Actually, probably a year or two sooner than I thought. I thought this was going to be a multi-year, frankly, slog to like slowly and sort of methodically keep adding clinics to get to significant scale. I'm hoping we'll get to quite significant scale, and some of these specialties we will. I think we're not too far away. Before we're processing something close to $1 billion worth of scripts via our network of clinics, which is just like really big numbers. And so I'm excited to get to that scale as quickly as possible. so that we can in turn, start try with that scale, try actually start changing the system, changing the way the payers are treating this segment, changing the way pharma, manufacturers are thinking about this channel, and getting their support to try to change the system, and so forth. So I'm just excited about the traction we're getting, and how quickly we're hoping to get to scale.
Well, I'm excited to continue to stay in touch with you, and hopefully we can get you back on to come on one of our panels, and we can dive into more regarding the specialties pharmacy space. But it's been fun.
Yeah, yeah. Thanks for having me. It's a good conversation starter. As you can tell, there's plenty of more we can talk about here because it's such a rich area. But it's thank you for your interest in House RX, and having me on.
Absolutely. We'll have you on again soon.